Hey everyone, it's Dr. Brace here. It's Facial Plastics Friday, end of the day. It's 5 o'clock. We had a busy one today. It was at Guelph General Hospital. We did 2 reconstructive septorhinoplasties and then some parathyroid surgery, then back here to clinic for some cosmetic consults. But what I really want to talk about today was about what we're doing tomorrow. Tomorrow I'll be in Toronto for the Reveness filler course, the cadaver course. I'll be teaching that. I'm really excited. And I just wanted to come on here for Facial Plastics Friday and kind of describe what that means, what we're doing. You may have seen the ads for it. So basically, we will be injecting and talking about safe injection techniques for all different parts of the face. And so the most common areas we inject would be cheek, lips, chin and jawline, sometimes temple, sometimes nose for liquid rhinoplasty and tear troughs. And the really cool thing about this course is that all the participants are going to have dyed Reveness filler, and they'll be able to inject and talk about sort of the anatomy around those areas, the danger zones, where the nerves are, where the blood vessels are. They'll be able to inject, and then we'll be able to dissect out and see where that filler lives in the tissue plane, see what it kind of looks like in the body, so that as you're injecting, this is what I like to do when I'm injecting, when I'm teaching, is you want to picture in 3D where that is going, what is around it, and how to keep it safe. And so we'll be talking about the anatomy of the supraorbital vessels, supratrochlear vessels. We'll be talking about the infraorbital vessels, the mental nerve, and the neurovascular bundles here. We'll be talking about the facial artery as it comes into the angular artery and lateral nasal artery. We'll be talking about the superficial temporal artery and its anastomoses and some of its branches. And we'll be talking about some of the nerves in the face that you can block to make these injections a little more comfortable. And so that's what tomorrow is. What is filler? For those of you out there wondering, we get a lot of people sometimes that come in and say, I just want a little bit of Botox so that it can fill this line. And that's not what Botox does. That's filler. Filler is a gel. It's hyaluronic acid in most cases, and that is a part of the extracellular matrix. It's the part of our body in the tissues of our skin that binds water and hydrates and fills our skin. So when we inject the gel into a nasolabial fold or into a cheek or to a chin, wherever, it is doing 2 things really. It itself is taking up space and expanding the tissue, and it's also bringing water in, and the water is kind of hydrating and further expanding that area, so that areas where you have volume loss, you now have it replaced with the gel. It isn't really dissolvable, or it doesn't really dissolve. It is dissolvable, but a lot of people think about filler as something that you have to repeat every 6 months because it goes away. And I've found that that's really not true. There are people where I have operated on them where they told me they had filler 10 years prior, and I find the filler in their face. I've seen it more than 10 years in a nose before, where liquid rhinoplasty had been done. When I opened the nose, all the filler was still there. So it doesn't really ever go away. It kind of incorporates into the tissue. It loses its turgor, or its ability to expand, and becomes more mushy. And that's what you see kind of clinically, where you feel like you have to do it again. But we'll be talking about that. We'll be talking about how to dissolve filler, to actually get rid of it if you really need to, if somebody's had a complication. And so that's my weekend. It's a snowy one today. Hopefully the weather is better, and everybody stay safe and have a great Facial Plastics Friday.